my name is Ashley Ridquist. I'm from Juneau, Wisconsin, and I just graduated in May of 2011 with my Bachelor's of Science in Nursing, and I currently work at UW Health Partners Watertown Regional Medical Center as a registered nurse.
Well, Ashley, thank you so much for helping out the First Year Studies program today and being willing to answer a few questions for us. So our first question for you, Ashley, is when you think back about your experience here at Marian, what knowledge, skills, and abilities did you learn that is currently helping you be successful as a nurse?
Well, the first thing I'd have to say is time management. While I was here at Marian, I had to manage my time every single day with studying all the time in the library and then making sure that I had everything prepared for my classes the next day as well. So time management was a big thing that I learned here and used, and I still use that in my job every single day as I'm preparing for my shift and getting my report on my patients. I need to use time management to get everything done effectively. The other thing that I use every single day would be close reading, and in that we have to make sure that we read everything the first time through, and you need to make sure that you read the whole entire report of the patient so that you know exactly what is going on with that patient, not just their age, not just their diagnosis, but the background and history as well. With that, you need to ask questions. After I get report on my patients every day, I need to talk to my doctors and ask them pertinent questions. It's very important that I ask them the right questions to what I just read. And in interviewing patients, it's important to ask questions as well to them. They're in there to find out what's wrong with them, and they need questions asked to them so we can find out their background and history. So when I'm talking to patients, not only do I need to close read their history and background, but I also need to reply to them then and ask lots of questions so that we can figure out what's really going on with them.
Okay. Well, Ashley, if you think about your time at Marian, what experiences like co-curricular or coursework also helped you to gain the skills you just talked about?
Well, first of all, this is going to sound a little cheesy, and I swear Jen did not pay me, but I have to say Gen 101, and in that, when I was a first-year student, I really didn't fully understand where I was going with this. I didn't understand how it would fit into my liberal arts curriculum and how it would fit into me being a nurse. In that, we learned critical thinking, and that's probably the biggest thing I took out of Gen 101. And it really hit me when I was a senior this last year, when in every single nursing class, the teacher would say, critical thinking, and I went back to Gen 101 every single time and really thought, oh my goodness, we really learned critical thinking when I was a first-year student, and I use it every single day. Every single NCLEX question is critical thinking. You need to read the question and critically think through it. Every single day at my job, when a doctor gives me an order or a patient has a question or something acute is happening with the patient, I have to critically think through that and make a decision. So I'd have to say Gen 101 is probably the #1 course right from the beginning that has helped me throughout college here. So the other thing that really also helped me would be my medical surgical class, also known as Med-Surg is what you'll hear it referred to. And in that, it just gave me a base of nursing, whether I'm doing OB, whether I'm doing ER or pediatrics with children, it all brings me back to Med-Surg, and it's just a very good base for nursing. So I'd have to say that really gave me the skills and competency to be a nurse.
Okay. And lastly, Ashley, if you could give the first-year students a piece of advice, those future nurses, and they're working hard to become a nurse, what piece of advice would you give those first-year students?
I would have to say never give up. It's going to be the hardest 4 years of your life, and it all is worth it in the end. There were times when I just was so tired of studying, but I kept doing it. Something that really helped me was study groups. I really relied on my friends, and we studied every single day in the library together, and we made it fun. I mean, we got pizza, and we studied every single night together, and we really pushed each other. So I'd have to say never give up and just succeed, and you will.
Wonderful. Well, Ashley, I hope you enjoyed your homecoming experience here at Marian this weekend, and know that First Year Studies program appreciates hearing from you, and I'm sure those future nurses do as well. So thank you.
Thank you.